Hi, and welcome back to the podcast, Your Life Transformed. I am your host, Dr. Franchel Hamilton, and we are continuing our series on the Bariatric Journey. I am excited for our guest today, Melanie Bunz, who is going to talk about her journey, pre and post, and what she's currently going through. So I'm excited for her to be on the show and share her real life journey in this conversation today. Hey, Melanie, how are you?
Hi, Dr. Hamilton. I'm great. How are you doing?
I'm good. Thank you so much for being on the show. I know sometimes it's hard to talk about this, but I'm glad you're here and we're able to kind of have a raw conversation about this.
Yeah, no, I love talking about my journey, and I love talking about weight loss and just how the journey has changed my life. So I'm happy to be here. I'm honored to be here.
All right, perfect. Well, thank you. So usually I like to know, first of all, what surgery did you choose and why?
Okay, great question. So the surgery that I chose was the vertical sleeve. Originally, when I had thought and contemplated about weight loss surgery, I thought I needed to get a bypass. But once I met with my surgeon and then did my own research, I just found out, not that I found out. Why I decided to pick the vertical sleeve was after I got the info about each surgery, I was really freaked out about the bypass being that they go in and rearrange your intestines. Mm-hmm. That really scared me. And then also I know different surgeons say different things to different people, but he also told me there's, risk or complications down the line when you get older with that surgery. You could get an ulcer, you could get a kinked intestine. Yeah. And then he explained the vertical sleeve, how, they go in, they remove 80%. Well, he removed 80% of my stomach. And it's just like a clean cut. So for me, I thought, go inside and rearrange my intestines, or go in and just do a clean cut, take it out, it's gone, don't have to worry about it, and I heal and I'm sewed up. So I went, with the vertical sleeve. Although a lot of people say you lose more weight when you get the bypass, I don't really know if that's true. So far, I felt like it did a lot for me. I've lost, quite a bit of weight. So I'm happy with my decision. However, I was nervous about GERD. That was the only complication they talked about. But I didn't suffer from any acid reflux ever, except when I was pregnant. I had a little bit of acid reflux. And so I just went through with the sleeve. I was like, I'm not rearranging my intestines. No thanks.
Yeah, that's actually very common. Yeah. That's a common reason people decide to go with the sleeve versus the gastric bypass. The gastric bypass can have some more complications, additional that the sleeve does not have, right? They each kind of have their own ones, but there are some that are more specific to gastric bypass that the sleeve you typically do not have. And to kind of respond based on the book, although in my patients, and I'm sure you know people where it's been even, but based on the book, the bypass does lose a little bit more weight than the sleeve, but I've had patients do just as well with both. So yeah, I think you're right.
Yeah, I guess you are right. I guess they maybe do lose a little bit more. And I remember the nutritionist that worked with the surgeon was like, oh, you need to do a bypass. You need to do a bypass. I
wonder why did she say why she felt like you should do bypass? Or?
Oh, because you're 350 pounds or your highest weight was 350 pounds and you're real short and you're going to lose more weight. You're going to lose more weight. And when I talked to the surgeon was like, well, you're young. You don't have any acid reflux complications. And I don't know if it was his personal preference of doing the sleeve and not the bypass, but he was like, I think we should do the sleeve. And then that's when I did my research. And then that's what made my decision. We're going to cut it out and not worry about stuff being rearranged.
Yeah, no, I agree. And you can do just as well. How many months out are you right now?
So I will be 22 months next month. So I'm 21 months post-op. So almost 2 years.
Wow, that's great. And did I hear you say you were pregnant? Did you have a baby since your surgery or?
Oh, no. Okay. My daughter is 6.
That was before. Okay.
Yes, before. Hopefully in the future.
Yeah, okay, good. And then what made you decide to even get a bariatric surgery? What brought you into that surgeon's office?
So what brought me into the surgeon's office? So Like in my lower 20s, I always joked around like, I'm gonna have to get lipo. I can't lose the weight. Like, I'm gonna have to get lipo one day, blah, blah, blah. And I always joked around about it. I always joked around about like being the big girl or being overweight. And as time went on, I just kept gaining weight. It started about my early 20s, I believe. And then after I had my daughter in 2015, my weight just skyrocketed up. And before I knew it, I stepped on the scale. I was back home. And I remember this was like, what do people say? Not a mind blown. When they hit rock bottom, right? Like you hit rock bottom when something's going on in your life, right?
Yeah.
And I remember going back home to visit my family in Colorado. I live here in San Diego now. And I stepped on the scale in my grandma's bathroom. They had this old scale. And I was like, I'm going to step on it and see what it's like, because I haven't stepped on it for years. And it said 300. Well, first it said error. And I'm like, okay. So when I stepped on it again, it said 350 pounds. And I was like, oh my God, like, what is going on with you? We cannot, this is no, like you didn't
know you had gained. Yeah.
I mean, but something in your head, at least for me, I would block it out. Like I would look in the mirror and look at myself and think of myself looking like when I was like 16 or 18 years old. I wasn't looking at the real person in the mirror physically. Like my brain, blocked that out. So of course I knew, right? Like I could only shop at certain clothing stores. When I went on the airplane, I could barely wear the seatbelt with an extender, but I just kind of blocked it out. And when I stepped on that scale and, I was 350 pounds and I had talked about it previously, like I'm going to move to San Diego. It's a brand new life. I'm going to get the surgery. Well, I moved here. A year went by. I didn't do anything about it, but it was just that something turned on in my head, like a snap, a light bulb. And I was like, when I go back, I'm going to get serious. I'm going to call my insurance, call the program, and I got to get started. I got to get the surgery. This is going to be the only thing that's going to help me become a healthy, happy person again. And I wanted to live. I was scared, with being so overweight that I wasn't going to be able to see my daughter grow up, get married, have her own kids, and I was starting to get health complications as well.
Yeah, that's understandable. So that's kind of what triggered you to go in that surgeon's office. And so prior to that, were you feeling, what were things that you've done in the past? Did anything work or?
So things I've tried in the past, I've tried Weight Watchers. I've even tried Nutrisystem where they send your meals to you. I've had gym membership after gym membership. The cinnamon cayenne liquid diet, drink this, get cleansed. I've tried any diets you could think of. I've never tried Jenny Craig, just mostly I stuck to Weight Watchers and trying to go to the gym. And, it worked, but it didn't work because I wasn't consistent. I'd fall back into old habits. Like I would basically make food the enemy and deprive myself, which in reality made me want to eat.
Correct. Oh my gosh. That's exactly what happens. What happens. Yeah.
And thinking of it as a diet and a temporary fix, it's a lifestyle change to keep the weight off and to keep your health in the way I feel it should be for yourself. You got to hold yourself accountable to what you're doing. How many times are you going out to eat? What are you eating? When are you eating? Are you exercising? Are you not exercising? You have a gym membership. Do you have a workout plan? Are you doing this every day? Are you doing this 3 times a day? You have to be consistent. So for me, I felt like it never worked because I was never consistent.
Yeah, I agree. And I like what you said when you mentioned thinking of it as a diet versus a lifestyle change. A diet is something that's you can jump on, jump off, almost start or stop. So anybody who thinks of, I'm just going to go on a diet, that's automatically going to fail. And then the other thing I like that you said is almost like the mindset thing, and the fact that you felt like when you were on these, you deprived yourself so much that you wanted it more. That is a neurological thing. Like, that's happened so much, and this is what happens, quote unquote, in the diet industry anyway. Like, we make default habits that we're used to, and then when we try to, like, almost like trenches in a road, and then when we try to kind of veer off of those to do something temporary, the car wants to pull you back into those trenches, you know. And that's what happens over time. And so that's why those deprivation type of diets and programs will never work, because it's very difficult to kind of stay on that pathway. So no, that's, you hit the nail right on the head. And a lot of people, when they go through that, they almost, like, what I call, like, relapse. They, like, go on a quote unquote diet for so long, and then they can't stay on that diet. So they're like, forget it, I'm hungry, or have cravings. And then they start going to their cravings, and what society does, and what the person sometimes thinks is, oh, it's my fault. And so sometimes people, like, give in, so to speak. They're like, forget it, I'm not doing the diet anymore, I'm just gonna do what I want to do. But what's really happening, it's not the person's fault. This is a brain thing in the head. Your body was feeling deprived, and it triggered you to want to kind of do in these different directions. And then once you got, like, the sensation and the comfort from that, it was almost like, I'm just gonna stick with this, you know. But
it feels good.
Yeah, correct. It feels good. Yeah, exactly. And so, what after surgery then? How did you almost, like, control this? Like, or what are you doing now? Like, you don't deprive yourself, or do you? Like, what are you doing now to kind of make this a lifestyle?
Okay, so no, I do not deprive myself.
Yeah,
so I'm kind of struggling with that, and I'll touch back on that. But after surgery, to answer your first question, what did I do? Well, pre-op, before surgery, I was seeing a counselor. She was actually the counselor that did my evaluation to get the surgery, because, you know, when you're trying to get approved for bariatric surgery, at least for my insurance, you have to get mentally evaluated. You have to do these classes for 6 months. At least my classes were 6 months. I know
that's pretty standard.
Okay, everybody's different. I started to see her because I was supposed to have my surgery March 15th into 2020, but as we all know, COVID hit, and they canceled my surgery. And I'm like, oh no, like, I was so pumped, I was so ready. What am I going to do now? Like, I have to wait, but I still need to stick, you know, on trying to eat well, doing my protein shakes. And I'm like, I'm going to talk to the lady that approved my surgery, or, you know, that did my mental evaluation, and I'm going to do counseling with her, because this is like a mind thing. Like, you know, this is a head game. Like, there's not that there's something wrong in my head, but I know what I know from what I'm taught, and I only know what I've been doing, and I'm going to need some support. So I did counseling pre-op all the way until my rescheduled surgery, which was July 22nd, 2020. And I continued treatment for about a year and a half. I just recently stopped seeing her about 5 months ago. Perfect. So pre-op and after surgery, it was almost 2 years that I did therapy.
The mental work, and this is what's helped you, correct?
Oh gosh, yes. If I didn't do it before, I may have not even went through with the surgery. I might have just said, oh, Corona, you know, screw it. I'm not going to do this, because it was scary. Of course, I was scared to know that I was going to go cut an organ out of my body. I was going to remove 80% of my stomach. What was life going to be? Was I ever going to eat again? Would I ever be able to have an ice cream, drink a sip of soda? Like, it's scary. You don't know.
Exactly. It's definitely not an easy decision in choosing to do bariatric surgery. Just as you laid out, there's so many questions that go through your head. And you were lucky and very smart to get this help, this support, to be able to answer some of that. Sometimes, honestly, after surgery, people are just, like, left to their own devices, like, and don't know, you know, just kind of have these thoughts in their head, like, will I ever, could I ever, what happens if, you know what I'm saying? And honestly, after the surgery, if everything goes well, a lot of people don't see their bariatric surgeon regularly. You know what I'm saying? It's usually I'm 100% a proponent of the mental and the mindset reset that is required. It's not talked about in bariatric surgery. Your bariatric surgeon probably didn't even talk to you about it because we're not trained to do this. We send you guys for the evals as a checkbox, kind of like what you were saying, in order to get approval. But that part is so important, just to me, as important as the actual surgery. And that's kind of what I want to highlight. So I'm glad that you were able to get this help for almost 2 years. And so in response to how did you do it? How did you reset these different things to be able to deal with it after bariatric surgery? Your response is, I went to therapy, essentially, counseling, and that helped me through. Yeah, perfect.
Yeah, because it gave me the tools I needed to cope with what my diagnosis was. So I was diagnosed as an emotional eater / binge eater. And we kind of just really dug deep, figured out, like for me, I wanted to know, like, well, when did this happen? Why did this happen? Yep. What are the triggers? So learning all of that. And then, you know, my doctor was Dr. Shapiro. And she gave me, you know, like what's called a toolbox. And like, for example, what are things you can do when you're feeling overwhelmed or stressed that will keep you from running to the pantry to eat, to feel comforted. And so we would talk about items like, you know, lighting a candle, having a candle on, walking outside, feeling the sun, maybe even, you know, I work from home. I'm blessed to work from home. So taking a break and putting a TV show on for 10 minutes, just anything you could do. So we were taught to have a toolbox. So yes, I really feel what's kept me going and has kept me on track was definitely for sure the counseling, the therapy.
Yeah, well, honestly, and you made a good point, because I would say a large percentage of patients in general are emotional eaters. A lot of people are emotional eaters. This is a very common thing, right? Some people, because they're emotional eaters, are more genetically predispositioned to have obesity or diabetes or whatever it is, right? Other people, you may know, can emotionally eat nothing. You know what I'm saying? So it's a very common diagnosis. And then, but for those who are predisposed genetically or environmentally or all these reasons to end up with chronic conditions, those you need to probably address the triggers. And so surgery alone does not treat that. Like, I just want to put that out there, because there's so many other diagnoses that go into perhaps when you're getting a bariatric surgery: anxiety, sometimes depression, emotional eating, binge eating. Like, there's so many other things, right? That doing a surgery is not going to treat those things. So if you don't get treatment for those things, you potentially could sabotage your bariatric surgery. So I just want to throw that out there, because that's perfect. You're absolutely right.
Yeah, and you are so correct, because, okay, sure, for the time being, you know, you're not eating much. You're eating,
correct. Initially.
But eventually, you're going to be able not to eat like you used to eat, but you're going to be able to tolerate more things. And if you didn't kill what's up here, you know, there is potential to, like you said, sabotage your bariatric surgery. You could go back into old habits, you know, and nothing wrong with gaining some weight after bariatric surgery. You know, that is normal. However, everybody that's done bariatric surgery have all done this for, you know, our personal reasons. And of course, we never want to go back to what our highest weight was, or what it was we were feeling, or how we were, you know, like for me, I feel like a brand new person. So you are so correct. Bariatric surgery does not cure your head. It does not.
Correct.